Am I recording? I am recording. Okay, great. Here we go. So question one, why is it necessary for a massage therapist to conduct a full initial consultation with a client before proceeding to give a massage? Is it A, to decide whether the client should receive treatment based on his or her social status? B, to ensure that the client does not have a criminal record? C, to determine the client's reason for seeking massage therapy? Or D, all of the above? The answer should be C. Let's see if I got that right. And
Yeah.
the answer is correct. Yeah. Okay. So you can let me know later, Ginny, if you have a question about something. But for now, try not to call out. Right. Okay. So different clients have different reasons for seeking massage therapy, and a consult assesses the client's needs. Also, just want to point out that the first two answers should be irrelevant to the functioning of the massage therapist with the client therapeutically. Okay, next question. A client may wish to receive a massage for which of the following reasons? To relieve stress, to increase range of motion, to reduce muscle tension, or all of the above? And the answer should be all of the above. And that is correct. So I'm just going to keep going. Any opportunity we have to just keep moving, I'm going to keep things moving. Which of the following is false? A massage therapist can decide on the type of massage that is best suited for a client depending on his or her state of health. Different massage techniques are used on different clients based on their individual needs. The client should provide information on his or her state of health to the massage therapist. None of the above. Well, it has to be one of them, right? So it cannot be none of the above. So it's either A, B, or C. Client should provide information on his or her state of health to the massage therapist. That sounds pretty pertinent. Different massage techniques are used on different clients based on their individual needs. That sounds true. A massage therapist can decide on the type of massage that's best suited for a client, depending on his or her state of health. All three of these seem, why don't you guys unmute now? Larissa and Crystal and Ginny. All three of these seem true to me, so I'm gonna crowdsource it and ask you which one seems false.
I think it's C.
C. Okay.
I say
So
A.
You say A. Okay, let's try C. It says incorrect. So now let's try A.
Did it?
And that is also true. So now let's try B. And that is also true. And it's the incorrect answer is the one I told you it cannot be. So don't listen to me. Because what do I know? Okay, verbal consultation between a client and a massage therapist involves signing a consent form, filling out an intake form, the therapist introducing him or herself by name, the client sending the therapist an email requesting information about massage services. So this last one would not be part of the intake, part of the consultation. Oh, for me, that's not part of the consult. Let's see, which one do you guys think it is? I think it's A. Okay, let's try A. It's not A. Verbal consultation between a client and massage therapist involves, let's try C. That's it, yeah. I see. And the trick is that involves speaking rather than signing forms, which are all forms of written communication. I see. Okay. Wait a minute. Let me read that. Let me read that again because it's confusing to me. Is that confusing to anybody else or is it clear to everybody? Are you guys still there? Yeah, I have to turn my screen off from time to time, but you should still be able to hear me. Verbal consultation between a client and a massage therapist involves signing a consent form, so that's not verbal. Filling out an intake form, also not verbal, that's written. The therapist introducing him or herself by name, the client sending a therapist an email. Okay, yeah, I see. So only C is actually verbal. Okay, next one. During the verbal part of a consultation, a therapist may jot down details about the client, such as diet, activity level, contraindications, or all of the above. Yeah, okay, just call out if I ask for crowdsourcing. So I'll try all of the above, and that is correct. Okay, in this modern era, massage appointments are largely made via website scheduling, telephone, or mobile apps. I would go for all of the above. All right. After assessing the client based on his/her personal and medical information, the massage therapist explains to the client the process undertaken during the massage, allows the client to ask any questions he or she might have, proceeds to give a client a massage, bills the client for the massage service received. After assessing the client based on his or her personal and medical information, the massage therapist explains to the client the process undertaken during massage, allows the client to ask any questions, proceeds to give the client a massage, bills the client for massage services received. Okay, so this one is a little tricky. So
Mhm.
let's just go through it, unless anybody has a strong opinion, and find the correct answer. Okay, so according to them, it is explaining to the client the process undertaken during massage. It's not allowing the client to ask questions, and it's not proceeding to the client massage, and it's not billing. So let's see if we can figure out why from the description. After verbal and/or physical consultation, the therapist tries to ensure the client is aware of what awaits him or her by explaining the process that would be undertaken during the massage
Mhm.
procedure. After ensuring that the client is aware of what to expect and what is expected of him or her, the therapist conducts a question and answer session while clarification is provided where required. Question and answer session. Okay. So it sounds to me like from the description of a question and answer, from the mention of a question and answer session for clarification, sounds to me like the answer could also be B.
Mhm.
Do you guys agree that it seems like there could be two answers for this question?
I agree.
Okay, so I think what we ought to do is now have a discussion about why it's A and not B. So let's read the question again. You always read the question again.
Okay.
After assessing the client based on his or her personal and medical information, the massage therapist explains to the client the process undertaken during the massage, allows the client to ask any questions he or she might have, proceeds to give the massage, bills the client. All right. Now the explanation. After verbal and/or physical consultation, the therapist tries to ensure the client is aware of what awaits him or her by explaining the process. Okay. After ensuring that the client is aware of what to expect. I see. Then the therapist conducts a question and answer session. Do you guys see that there's an order described here in the description? Does anybody not see the order? Okay. So they're saying that it's verbal physical consultation first,
Mhm.
make sure the client is, and then explain the process to the client, then allow for question and answer, then give the massage, then bill the client. So these are in order. A massage therapist should ensure that he or she truthfully and clearly answers any questions that a client might have, avoids answering questions that he/she finds are unnecessary, continues with the massage whether the client is comfortable or not, or all of the above. Well, you're not going to continue with a client with a massage if the client is truly uncomfortable and if they express that to you. So avoiding answering questions that you find are unnecessary, possibly. Truthfully and clearly answer questions that the client might have. That seems like a pretty good one to go with for now.
Mhm.
And that is correct. Okay, you guys go ahead and mute yourselves now, please. A massage therapist can help to make her clients comfortable by doing which of the following: providing a face rest, providing clarification on information that is not very clear to them, always maintaining a clean and tidy environment, always avoiding silence in the room by talking to the client. Always avoiding silence in the room by talking to the client. Okay, always maintaining a clean and tidy environment, providing clarification on information that's not very clear to them, providing a face rest. So I think it's 1, 2, and 3, but not 4. So let's try that. And that is correct. Okay, the client intake form usually contains details such as the client's date of birth, the reason for the massage therapy session, existing health conditions, or the client's address. Client intake form. client's date of birth, reason for the massage therapy session, existing health conditions, client's address. So I'm going to say 1, 2, 3, and 4. And that also is correct. A blank informs clients of important information regarding massage services so that they can actively consent to participate in the service or not to participate in the service. A blank informs clients of important information regarding massage services so that they can actively consent to participate in the service or not. A waiver form, informed consent, massage intake, or SOAP form. I believe it'd be the informed consent. It's the informed consent form, so let's keep going. Why is it important that massage therapists have their clients fill out a consent form? 1, it can provide some level of protection to the individual or businesses providing the massage services. Number 2, it helps to prevent injury, loss, or damage to the client by clearly stating any possible outcomes and risks of receiving the services. Number 3, it completely protects the massage therapist and or business from any liability associated with a person participating in massage services. Number 4, it informs the client of the guidelines for receiving a massage. So I don't believe it's going to be 3. And as for 1, it can provide some level of protection to the individual and business providing massage services. That's like a more moderate version of what 3 says, which is any liability. So I believe that 1 is a possibility. I'm just looking for a charging cord for my phone because we have someone who's joined by phone. Number 2, it helps to prevent injury, loss, or damage to the client by clearly stating any possible outcomes and risks of receiving the service. In my mind, that is definitely true because that's what an informed consent is for. Number 4, it informs the client of the guidelines for receiving massage. So the informed.
Sorry, I don't mean to cut you off, but I can't hear you.
Okay, can you hear me now?
Now I can, yes.
Okay, I'm going to switch to my headset. How's the sound now? Can you guys hear me?
I can hear you.
Ginny can hear me. How about now? You guys hear me okay?
Yeah.
Okay,
Can
okay,
hear
Ginny.
you.
All right. Okay, great. Thanks for letting me know. And if it's okay with you guys, I'd like to read through the different definitions of the forms because this kind of like specific stuff can be a little tricky. I hope that's all right with you guys. So a waiver is an agreement in which the client waives their legal right to sue the massage services provider in case of an injury, loss, or damage. And the question, remember, is not about a waiver, it's about a consent form. A waiver form and consent form are not the same thing. A consent form does not give the massage therapist complete legal protection if harm is done during the massage. That's reference to number 3. But it can provide some level of protection to the business or therapist depending on what is in the printed form. Do we have any questions about that before we move on? I hope not. Great. Okay, so next question. The benefits of using a client intake form include client intake form, right? It allows the therapist to plan his or her work as accurately as possible. It saves time. It allows the therapist to determine if the client is the right fit for the service he or she offers. It allows the therapist to gather and share client details with other massage therapists or businesses. So for client intake form, okay. So remember that an intake form usually includes things like a health history, physical examination, verbal examination, subjective, objective assessment plan, right? So it's not really the document that's oriented towards marketing. So I'd say number 4, probably not. Allows the therapist to determine if the client is the right fit. Yes, because if they're coming for something that you don't treat, or that's not in the scope of a massage therapist, or that you're not comfortable trying to treat, then this would be a good time to discern that. It saves time. Yeah, it definitely saves time. Definitely, because you document everything. The person comes back, you look at the document, you know what their complaint is. Sure, it saves time. It allows the therapist to plan his or her work. Yeah, his plan, SOAP. So subjective, objective assessment and plan. Plan is part of it. So I'll say 1, 2, and 3. I hope I'm not like dragging you guys through the details. I just sometimes I have to decide when to be thorough and when not to be. And it's toss up sometimes. Speaking of SOAP, subjective, objective assessment and plan form is used to outline legal, professional, and person boundaries between client and massage therapist, assess and document a client's condition and progress, provide the client with physical exercises to do on his or her own after receiving massage, or none of the above. I'm going to say assess and document a client's condition. And that's the correct answer. Let's just look at what this says, right? SOAP notes are used by the massage therapist at intake and at subsequent visits to document a client's condition and progress. Here you go. During each session, the massage therapist writes notes on a patient's chart based on the 4 components of subjective, objective, activity, and plan or assessment. We have a generator. Okay. Next one. The benefits of taking SOAP notes includes they can be used by third parties, such as insurance companies and Medicare. They assist the therapist to plan and organize massage treatments as they record the progress of the treatment. They can be used in court to protect the therapist in case the client decides to take legal action against him or her, for future reference and for the treatment of the client. SOAP notes, yeah, for future reference and treatment of the client. Number 4, for sure. They can be used in court to protect the therapist. Yeah, definitely, because it's a legal document, the SOAP notes. They assist the therapist to plan and organize massage treatment plans as they record the progress. Definitely. They can be used by third parties such as insurance companies and Medicare. Yes, insurance companies will ask you for SOAP notes. So I'll say 1, 2, 3, and 4. Excellent. Which component of SOAP is initially the client's primary complaint? The reason for seeking massage therapy is that the objective complaint, is that the activity, the subjective complaint, or the plan? It's the subjective. Okay, this component of SOAP consists of the clinical observation of the therapist, including the 4 T's: temperature, texture, tenderness, and tone, palpation, and medical diagnosis. This component of SOAP, is it the activity, the initial, the objective, or the medical? It'd be the objective because that's information that you take regarding what you feel. And that is correct. The assessment component is aimed at conducting follow-up assessments, planning the successive treatments, determining the cause of the symptoms displayed by the patient, all of the above. Okay, the assessment. Determining the cause. Yeah, the diagnosis is part of the assessment. Yeah, planning the successive treatments. Well, not really plan, but the whole document contributes to a plan. Conducting follow-up assessments, no. So I'm going to say C. Yeah. Which of the following is false? The quote unquote plan section of SOAP notes usually includes recommendations on the frequency and the duration of the treatment. Massage therapists should avoid making vague assessments in the assessment part of SOAP notes. A massage therapist's personal opinions and judgments should be included in the objective section of his or her SOAP notes. And lastly, the patient's response to the treatment administered can be included in the assessment section of the SOAP notes. Okay. Okay, let's crowdsource. Long sentences. I'm tired of talking. So you guys tell me, which one do you think it is? Just call out. Okay, all right. Well, that's not one of the choices. So I'll read them. I'll read them again. Unless anybody is confident of one of them, just go ahead and call out. Go ahead and interrupt. Okay, which is false? The plan section of the SOAP notes usually includes recommendations on the frequency and the duration of the treatment. I think that's true. Plan, frequency and duration. Massage therapists should avoid making vague assessments in the assessment part of SOAP notes. I don't think that's false. Vague is pretty subjective. I would make a broad assessment first, and after a couple treatments, start to narrow it down to what's the cause. For example, lower back pain versus psoas spasm versus disc herniation versus referred pain, just as an example. A massage therapist's personal opinions and judgments should be included in the objective session of his/her SOAP notes. I see. Okay, that one's probably the false one. Did you guys see that the first time or no?
No.
Okay, all right. Okay, yeah, you don't see the questions, right, Ginny? Can you see, you don't, but you don't actually visually see the questions right now, do you? Okay. Yeah. Okay, let me just set the see, we have 2 Zoom sessions here happening, which next week we're going to have 1 Zoom session all together, right, Ginny? Sweet. Okay, so I will set this up so that you can see it, right? Will I set it up so you can see it? I guess I'm just going to have to hold it. Okay. Okay, I'll hold it so you can see it. All right, let's move on. Oops, let me go back, make sure I didn't skip one. Yes, okay, let's keep going. Okay, failure to follow the stipulated procedure for delivering massage therapy services can result in poor client-patient relationship, giving poor quality services, becoming a liability to your company, all of the above. Poor client-patient relationship, yeah. Giving poor quality services, becoming a liability, all of the above. Can you see the screen? Yeah. Can you see the screen, Ginny? Okay. All right. Okie dokie. All right. So watch the video, okay? All right. Signs of an ideal posture include a neutral pelvis, a balanced muscles, the spine maintains its natural curvature, all the above. I'm going to say all the above, although neutral pelvis, not really. We could argue about that, right? Okay. Yeah. How is postural assessment done? Is it done by visually and physically assessing the state of the client or via x-rays? Is it done through surgical procedures on specific joints of the individual or all of the above? I would say, since surgery and x-rays are not within our scope, probably just by visual and physical. You guys go ahead and mute yourselves again, and I'll definitely ask you to unmute again. Which of the statements below is false? Having an understanding of the ideal posture is not necessary for massage therapists. Posture can be defined as the position of the body at any given time. Postural assessment is a form of visual assessment. A massage therapist can recognize poor posture by checking to see if the client's knees point inward rather than forward. I would say that the false one is the first one. Yes. Lordosis is the excessive, what kind of curving of the spine? Inward, outward, leftward, or rightward? Okay, so I can't see your hands, but raise your hand if you've ever heard of the lordotic curve described as an inward or outward curve. I've never heard of an inward or outward curve in the spine. There's a flexed curve, there's an extended curve, also called the concave and the convex, respectively. Inward and outward. So who wants to take a guess? Anyone? Is it?
I will.
Okay, which one do you think it is?
I'm gonna say inward.
It's confusing. Okay, let's try it. Yeah. Ding, 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 ding. Way to go. Lordosis is defined as an excessive inward curve of the spine. So I would remember it like this. When they say inward, they mean into the body. Blank refers to the curvature. Mute your microphone, please, Ginny. Blank refers to the curvature of the spine to the left or the right side. That is scoliosis, to the left or the right. Oh, listen to this. Okay, kyphosis is an excessive outward curve of the spine. Yes. Okay, I just wanted you to hear that. The blank posture can be identified by a torso which is pushed upward and forward, while the blank posture can be recognized as a forward tilted head and a posterior tilt in the pelvis. So I would say a torso which is pushed upward and forward, upward and forward. I'm not going to guess that one yet. While the blank posture can be recognized by a forward tilted head and a posterior tilt in the pelvis. So you guys call out, which one do you think has a posterior tilt in the pelvis? Hunchback, flat back, ideal, or high shoulder?
Hunchback.
Hunchback. Okay, let's go with hunchback. And then let's read the sentence with ideal. The ideal posture can be identified by a torso which is pushed upward and forward, while the hunchback posture can be recognized as a forward tilted head posture and a posterior tilt in the pelvis. I mean, it sounds like hunchback. It sounds like hunchback. Okay, let's try military, which sounds like an upward and forward torso. And that is correct. A flat back. Okay, this is good to know. Let's figure this out here. Let's educate ourselves. The ideal posture can be recognized by characteristics such as balanced muscles, a neutral pelvis, the head in line with the shoulders, and earlobes directly over the shoulders. In an ideal posture, the line of gravity should pass through specific points of the body, including the lobe of the ear, the shoulder joint, and the hip joint. Lobe of the ear, the shoulder joint, down into the hip joint when viewed from the side. Now, it doesn't explain to us why a forward tilt in the head, and a posterior tilt in the pelvis gives you a flat back. Just, with stuff like this, just remember, try to commit this concept of flat back being forward tilted head and posterior tilt in the pelvis. Try to commit that to memory, because if you see it again and it's really tricky, like non-intuitive, you want to be prepared. And there's a few things on the MBLEx questions which are idiosyncratic, like unique to the MBLEx. We're going to take a break in 5 minutes, and then we're going to come back. We're going to take a break for like a bio break for like 5 minutes. What is an assessment of a person's walking or running pattern used to identify biomechanical abnormalities? Is it the stride pattern? Is it the pelvic assessment, the gait analysis, or the postural assessment? I don't know this one. Okay, let's pick gait. Gait refers to the manner or pattern of walking. That's correct, Ginny. Gait refers to the manner or pattern of walking. Gait assessment is used to plan and treat individuals with conditions affecting their ability to walk. It includes measurable determinants such as a 2 to 4 inch wide base, a step length of around 15 inches, and an average of 90 to 120 steps per minute. Visual inspection of the body's movement is also part of the gait analysis. I was hoping they would define the other patterns and assessments, but they didn't. The gait cycle consists of which 2 phases? Anterior and posterior, stance and swing, left side and right side, forward and backward. Let's try stance and swing. That is correct. Which of the following is false? In the gait cycle, the stance phase is the phase where the foot is in contact with the ground. The swing phase of the gait cycle consists of acceleration, mid-swing, and deceleration. During gait analysis, the head, neck, and arm movements are visually inspected, or none of the above, which is false. In the gait cycle, the stance phase is the phase where the foot is in contact with the ground. That sounds pretty true. The swing phase of the gait cycle consists of acceleration, mid-swing, and deceleration. Sounds good to me. During gait analysis, the head, neck, and arm movements are visually inspected. Yeah. So I would say they're all true. Let's see. Let's find out. And that is true. All true. Which one of the following refers to using one's hand in assessing the body of another individual, especially when evaluating the person's health? That would be palpation. A massage therapist can evaluate certain characteristics of the muscles through palpation. These characteristics include tightness and looseness, inflamed or injured muscles, adhesions, pressure points, or all of the above. I would say the answer is all of the above. That's correct. What are trigger points? Are they hyper irritable spots located in the taut bands of skeletal muscles fascia, which produce pain or tenderness? Are they weak or elongated muscles located in the limbs? Short or tight muscles located in the neck and shoulders? Are they the contraction of the muscle in areas where pressure is applied? I would say they are not weak or elongated muscles. They can be short and tight muscles, but a point is not a muscle. A point is within the muscle. The contraction of the muscle in areas where pressure is applied, that sounds like guarding or something like that. So let's say they're hyper irritable spots. Good. Which of the following is false? Referred pain, also called reflective pain, is pain perceived at a location other than the site of the painful stimulus. Trigger points may develop as a result of lack of exercise. Chronic stress conditions can result in the development of trigger points. Contrary to popular belief, trigger points do not develop as a result of vitamin deficiencies. Which of the following is false? Referred pain, also called reflective pain, is pain received at a location other than the site of the painful stimulus. Trigger points may develop as a result of lack of exercise. Chronic stress condition can result in the development of trigger points. Contrary to popular belief, trigger points do not develop as a result of vitamin deficiencies. Let's pick that one because the other three seem to be sound to me. And that is correct. Can result in deficiency of vitamins and minerals, particularly C, B, D, folic acid, and iron. Very interesting. The first step in administering a proper palpation assessment is knowing where the attachments of the target muscle that is being palpated or located. Engaging the target muscle so that it hardens and stands out from the adjacent soft tissues. Adding resistance to the contraction of the target muscle, releasing trigger points in the muscles. First step in administering proper palpation assessment. That's not going to be a release. Adding resistance to the contraction of the target muscle. Is that part of the first step of administering proper palpation assessment? Engaging the target muscle so it hardens and stands out from the adjacent soft tissues. I've never heard of that as a good assessment or a good treatment technique. Knowing where the attachments of the target muscles that is being palpated and located are. Well, I would say that probably comes before the assessment. So I'm going to ask you guys. I think the answer is C. Adding resistance to the contraction of the target muscle. Which do you guys think it is? Okay, Crystal, Larissa,
C.
think it's C? Okay. That's incorrect. So it's not adding resistance to the contraction of the target muscle. So I'm going to just go through them. Wow.
That's what I was going to say.
All right. Yeah. Okay. All right. All right. Good. Good enough. Why does adding resistance to movements make muscles easier to palpate? Because it increases the length of the muscles, giving it a larger surface area. Because it makes the muscle harder, so it pops out among the adjacent soft tissues. It strengthens the muscles so that pain is reduced during the massage. It aids the relaxation of tight muscles. Why does adding resistance to movements make muscles easier to palpate? No. Let's try B.
Mhm.
Yeah, that's correct. All right, good. Okay, let's take a break. 5-minute bio break. I'm not strict about the 5 minutes, but if most people are here at 5 minutes, I'll be starting. So just go do what you got to do and come right back. Okay. Factors that decrease the range of motion of a joint include
I'm gonna say one.
fibrosis. Fibrosis, definitely.
Yeah.
Previous injuries, number 2, previous injuries would
Okay.
definitely decrease the range of motion. Poor posture, number 3, definitely could decrease the range of motion. How about huge muscles? Not by default. I wouldn't say all of the above. Does deep tissue decrease the range of motion of a joint? Decrease the range of
No.
motion of a joint? Deep
No.
tissue massage? Should increase, yeah. I mean, if you overdo it, they can become swollen and inflamed.
Mhm.
But that's not, but properly gauged, I don't want to say properly, if you accurately gauge the person's tolerance, the inflammation will not overwhelm them. So I'm going to say fibrosis, previous injuries, poor posture, only 1, 2, and 3. 4, huge muscles, that's pretty subjective. I don't think. I know a lot of calisthenics athletes who are extremely flexible. 1, 2, and 3, they're not going to let me get away with it. According to them, it's huge muscles. With huge muscles, such as a bodybuilder, has a decreased range of motion due to the amount of muscle mass. This statement is not true, but it's true for the exam. You know what I mean? A joint's range of motion can be assessed through active range of motion exercises. Active range of motion exercise involves movement being applied to a joint by another person, the individual using his or her muscles and ability to move the injured body part without assistance from an external force, extension but no flexion of the joints, the use external force to partially assist an individual with performing the movement. To partially assist. No. Extension but no flexion. No. Range of motion includes extension and flexion and lots of other movements too. The individual using his or her muscles and ability to move the injured body part without assistance from an external force. Yeah. Any
Hey,
confusion over that one?
can we go back to 40? That was a little confusing. Just read the bottom of it quick.
Oh, okay. You mean this part down here?
Yeah.
Okay. A deep tissue massage is often used to increase range of motion as it loosens tight muscles. Fibrosis leads to the degradation of the fibrous connective tissue, hence a decrease in flexibility. A person with huge muscles, such as a bodybuilder, has a decreased range of motion due to the amount of muscle mass.
Okay.
Yeah. And, also, I guess they're assuming that they don't have to explain that previous injuries or poor posture can decrease range of motion.
Yeah.
We good?
Yes.
Okay. Okay, number 42. Due to which circumstances are passive range of motion exercises performed? Due to which circumstances are passive range of motion exercises performed? During the initial healing phase of a patient after surgery, on a paralyzed patient, when the patient cannot move his or her body part or on his or her own, all of the above. Speak up if anything is not clear. Select the correct statement. The full movement of the body part through its joint is referred to as the range of motion. An example of passive range of motion is the patient moving his or her shoulder in circles on his or her own. Clients who have had a history of joint fractures or surgeries are usually always able to undergo a normal range of motion. An inclinometer measures range of motion in inches. Yeah. No. Select the correct statement. A full movement of the body part through its joint is referred to as the range of motion. An example of passive range of motion is the patient moving his or her shoulder in circles on his or her own. Passive range of motion, moving his or her shoulder on his or her own, not his or her own if it's passive. Clients who have had Let's try A. Yes, the full movement potential of a joint is referred to as its range of motion. If someone is moving his or her shoulder in circles without assistance, he or she is performing an active range of motion exercise. Clients who have had a history of joint fractures or surgeries usually require therapy in regaining their normal range of motion. An inclinometer measures range of motion in degrees, not inches. Which of the statements is incorrect? Incorrect. Flexion is a movement that decreases the angle between two body parts. Passive assistive range of motion exercise, excuse me, is typically used for an individual who's able to move the injured body part but requires some external help. That sounds like it might be correct. Before performing a passive assessment on a patient, a therapist would first perform an active assessment. Before performing a passive assessment on a patient. What's a passive assessment? Has anybody ever heard of that? Okay. Or none of the above is incorrect. Flexion decreases, Passive assistive, this sounds like it's probably correct. And we've heard of passive and active assessments. So let's choose none of the above. None of the above are incorrect. Ooh. Okay. This is good. We got non-intuitive. We have non-intuitive questions and answers. So this good will help us learn. Well, what were you going to say? Well, that would be all of the above if all three of these were incorrect. And also the option is none of the above, not all of the above. None of the above meaning none of them are incorrect. They are all correct. Flexion is a movement that decreases the angle. Yes, that's true. Oh, let's read down here. By first performing an active assessment, a therapist will have an understanding of the difficulties the patient experiences during the active assessment and can then determine the most effective treatment for the patient. Active passive range of motion exercise is typically used when the individual is able to move the injured body part, but to avoid further damage, he or she might require some external help from another person or machine. Active assistive range of motion. This says passive assistive range of motion exercise. See the difference? Okay, so the option that is incorrect is written passive assistive range of motion exercise, passive assistive. The technique, the range of motion exercise should read active assistive range of motion. See at the bottom here where my cursor is? Active assistive range of motion. See it down there? Is everybody clear?
Yes.
You are or are not?
I
Okay,
am.
great. Good. Great. Excellent. What refers to the range of movement in the joints and the length in muscles that cross the joints? Is it endurance, movement, flexibility, or active range of motion? Which one refers to the range of motion in the joints and the length in the muscles that cross the joints? Endurance, movement, flexibility, or active range of motion? Which one do you think it is? Do you think it's active range of motion?
I'm going to say active.
Okay, let's give it a try.
Oh.
The answer is incorrect. So let's see, it's probably flexibility. Yeah, the flexibility of an individual is tied to several factors, some of which can be controlled and others which are not within a person's control. Increased flexibility can occur both at joints and muscles and can be gained through massage, particularly deep tissue, remedial, and therapeutic massage. So the difference here is that flexibility is something that would be demonstrated through active range of motion. You have someone do active range of motion of the elbow in order to determine their flexibility of the elbow and the flexibility of the muscles and the tendons. Is that making sense? Anyone not understand?
I'm a little confused.
Okay, so let me come at it from the other way. So flexibility is an aspect of the joint range of motion, and the ability of the muscles to fully contract and fully relax. Flexibility that includes the muscles and the joints. Active range of motion is a test that determines how flexible someone is, how much range of motion they have in their joints, how much flexibility they have in their muscles. Does that make sense?
Yeah.
Yeah, kinda, or yeah.
Kinda.
Okay. All right. So you explain it back to me and do this on your own body while you're explaining it, okay?
Okay.
So flexibility is a term that includes what?
What is it?
Go like this with your elbow.
Okay.
Flexibility is a term that includes what? Yeah, just it's Larissa who's saying that you kind of understand, right? Okay, so just Larissa. So you're moving your elbow like this, right?
Mhm.
All right. And what is it that you're moving? Are you moving a muscle? Are you moving a joint? Are you using both?
My muscle.
A muscle, and the muscles are attached to different bones that open and close the
Joints.
joints. So you're using the muscle and the joint both,
Mhm.
correct?
Yes.
Okay, great. Flexibility includes the movement of the muscles and the joints.
Okay.
Flexibility is tied to several factors, including both the joint and the muscle.
Okay.
All right. And then active range of motion is actively extending and flexing the joint. That's active range of motion. So there's active range of motion in flexibility, included in flexibility. And active range of motion can be used to test your flexibility. If you bend over and touch your toes, that's active range of motion. If you can reach your toes or not, that's flexibility. Does that make sense?
Yes.
Okay, you explain it back to me now.
Quick question. Is there a passive flexibility?
Passive and active go with range of motion. They are included under the category of flexibility, under the umbrella of flexibility. Flexibility is broader than range of motion. Because the range of motion, here, let's go back. The range of motion is the amount of movement a joint is capable of. Here, the full movement of a body part through its joint is referred to as the range of motion. The full movement of a body part, so that's the forearm in this case, in the case of the elbow. The movement of the forearm through its joint. This movement is accomplished through the elbow joint. Range of motion is the movement of a body part, forearm, through its joint. Flexibility includes range of motion, and it includes the suppleness of the soft tissues. You are flexible if you can extend your elbow through the entire range of motion, through the entire joint range of motion. You are flexible if you can flex your elbow through the entire joint range of motion. Power lifters who need to get their hands this way and their elbows up, at first find it very difficult because this joint is not naturally flexible. You have to actively close the elbow joint forcefully several times in order to develop that flexibility, because it opens the joint and it stretches the tendons. You achieve flexibility when the joint has its full range of motion. Range of motion is for joints, not for soft tissues. You achieve your full flexibility when you have the full range of motion of the joint, and when the soft tissues are stretchy enough or flexible enough or pliable enough. Larissa? One more try and then we have to move on. Now, can you
Okay.
explain it back to me? The difference between, just start with describing range of motion and flexibility. So just start with range of motion. What is range of motion? Range of motion is only found in the joint, not in the soft tissues.
Range of motion is only found in the joints.
Yes, but I want you to say something like the range of motion is the full movement through the joint, or is the movement of a body part through the full movement of its joint, the full range of its joint. Or you can just say range of motion is joint movement. How about that?
Okay. So
Try that. Range of motion, just say range of motion.
range of
is joint
motion
movement.
is joint movement.
Yes,
Motion is joint movement. Okay.
yes. Suppleness is, suppleness pertains to the muscles. Soft tissues. Suppleness pertains to the soft tissue.
Okay.
Try that.
Supplements is
Suppleness,
soft tissues.
yes, suppleness is the soft tissues. Range of motion is the joints.
The joints.
Suppleness of the soft tissues and range of motion of the joint gives you flexibility.
Okay, I got it. So range of motion is in the joints and supplements is a soft tissue. Together is flexibility.
That's right.
Okay.
Ding, 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 ding. Wasn't it worth the time? Seriously,
Yes.
wasn't it worth the time? All right. Nice. Thanks for hanging in there. Okay, some of the principles employed during range of motion testing include testing the normal unaffected side first, performing passive tests on the patient before having him or her perform active tests, giving the patient clear instructions before performing tests on him or her, positioning the patient correctly before having him or her perform tests or exercises. Some of the principles employed include, so it's probably going to be more than one. So let me read them again to you. Number one, testing the normal or unaffected side first. I'll say yeah. So number one for sure. Number two, performing passive tests on the patient before having him or her perform active tests. I don't know that putting passive before active is one of them. So I'm going to wait on number two to decide number two. Number three, giving the patient clear instructions before performing tests on him or her. Clear instructions are should almost always be part of the process. Positioning the patient correctly before having him or her perform tests or exercises. I'll say number four for sure. So let's say 1, 3, and 4. 1, 3, and 4. 1, 3, and 4. Let's try that. And that's correct. Do you guys understand why it's not 2, performing passive tests on the patient before having him or her perform active tests?
Yeah.
Yeah. Let's see. It says right here, before performing a passive assessment on a patient, a therapist would first perform an active assessment. Okay, so why would you do an active assessment before passive? Why would you do that? Yeah, and more specifically, what do you want to prevent in seeing how well they can move? That's right. How might you injure someone in passive range of motion assessment? How might you injure someone doing a passive range of motion test? By you stretching the soft tissues past their point of suppleness or flexibility, or by you moving the joint past a range of motion that it's capable of doing. Both of them. Let's say there's that the person's having some elbow pain. If you open, now let's just split up the joint and the soft tissues, elbow pain, okay? So if you take a person's wrist, if you hold a person's wrist and hold their humerus and extend and flex their elbow, if they have a fractured ulna or fracture of any of the bones, ulnar radius humerus, you could open the fracture even more by moving it. But that person is not moving it themselves. They are not going to open it further. The pain will stop them. Do you agree on that? Okay, let's say that the pain in the elbow is being caused by some kind of soft tissue problem, by a swollen bursa or an irritated triceps tendon or a torn triceps tendon, right? If you first do a passive range, opening and closing their elbow, you could further irritate or further tear something that's swollen, irritated, or torn. Can we agree on that? But if you ask them to open and close their elbow first, they're going to stop when they feel the pain. Okay, is that unclear to anyone? Great. Sometimes you do get people who just, they're very disconnected from their bodies and they have very high pain tolerances, but it's rare. So you can say, I'd like to see you use your elbow, flexing and extending, but before you do that, I don't want you to move so far that you have pain. If you have pain, just stop. Well, I mean, we really shouldn't address like client stuff here, right? We really should just stick to the test, stick to the questions in front of us, because as you've seen, some of these questions are tricky. They're not intuitive, right? And some things that happen with clients might sort of contradict the answers that are non-intuitive, or they might not make sense in the context of a test. Also, it's just better just to be focused on the stuff here, right? Like I'm trying to find the concepts you guys don't understand on paper and make them a little bit more kinesthetic and a little bit more auditory and verbal and all that. Okay, physiological effects that occur on the body as a result of massage therapy include decreased vasodilation, increased tissue elasticity, decreased range of motion, increased temperature. Physiological effects that occur on the body as a result of massage therapy. Crystal.
Let's see.
Hello. What does this mean, decreased vasodilation?
I'm trying to remember what the vasodilation is.
Perfect.
seen-
I'm glad you don't remember. Yes. So what does it sound like? Vaso and dilation. Vaso refers to what?
Does that have something to do with like the vein?
Everything to do with the veins, with the vasculature.
Mm-hmm.
Good. And so what would dilation of the vasculature mean? Dilation.
I'm not sure.
Is that Crystal speaking?
Yeah.
Okay. So dilation and contraction are different. They're
Mhm.
opposites. Contraction is getting tighter, dilation is opening. So do you understand now that, can you sort of visualize that vasodilation is the opening of blood vessels?
Oh yeah, the blood vessels. That's right.
Blood vessels opening. And you understand also that blood vessels include arteries and veins.
Yes.
And you understand that arteries and veins, they become smaller until they become capillaries and they exchange.
Yes. Correct.
Okay, great. So decreased vasodilation would mean what is actually happening to the blood vessels? Decreased vasodilation. Are the blood vessels opening? Are they closing? Or is the rate at which they're opening just like going down?
They're closing, I think.
Yeah, they're closing, yeah. And also it might mean that of all the blood vessels in an area, a lot fewer of them or a lot fewer of them are actually dilating. They're not dilating or constricting, they're just sitting there like not dilating. The effective vasodilation is being decreased. Does that make sense to you?
Yeah, that's
Okay,
right.
great. Is that what happens during massage therapy? Is that a physiological effect that occurs during massage
Yeah,
therapy?
that would be
The,
one.
the decrease in vasodilation, the decrease of
No.
opening of the blood vessels?
Uh,
I didn't hear you, Crystal.
Is it not?
Just a minute. Sorry, Crystal.
I guess not. Yeah, I guess that isn't.
Yes, I guess not too. Can you
Yeah.
visualize or even like imagine in your body if you rub your own arm? What are these kinds of strokes called where you lightly stroke down toward the extremity? Okay, whatever it's called, right? Can you visualize or feel in your body your fingertips becoming warmer, your palm becoming warmer?
Yeah, that would be wouldn't that be an increase?
Yes, that would be an increase in vasodilation. So is decreased vasodilation a physiological effect that occurs on the body as a result of massage therapy?
No.
No. Larissa,
Yes.
elasticity, which is part of flexibility for soft tissues and also synonymous with suppleness of soft tissues. Elasticity, increased tissue elasticity. Is that something that should happen with massage therapy?
Elasticity. Yes.
Yes, definitely. What happens to the flexibility of a body part if you use massage therapy to increase the tissue elasticity? What happens to the flexibility if you use massage therapy to increase tissue elasticity?
What happens to the flexibility?
Yeah.
Increases?
Yes, it does. Ginny. Is that Ginny? Yes, and what would happen to your range of motion and your temperature? Would those increase or decrease? Yes, both of those would increase. So the answers should be increased tissue elasticity, decreased range of motion, increased temperature, 2, 3, and 4. 2, 3, and 4. Oh, whoa, I'm sorry. It says decreased range of motion, not increase. And you and I agreed it would be increased range of motion. So it should be increased tissue elasticity, increased temperature, 2 and 4. Let's try that. Okay, great. We learned a lot through that process. So, Crystal, can I pick on you for a minute?
Yeah, I'm still here.
So whenever you have a moment where you can't quite remember, oh, I don't really remember what vaso or what dilation means, go look those things up and write it down like 5 times, right? Vaso
Yeah.
equals vascular. Yeah, vaso equals vascular, right? Dilation and contraction. Dilation and contraction, those are opposites, right? Or dilation means opening. Yeah. Because those are like the fundamental building blocks in your foundation that will support the rest of your integrity, the rest of your structure. Vasodilation is the widening of blood vessels. It results from relaxation of smooth muscle cells within the vessel walls and allows more blood to travel through the blood vessels, resulting in a rise in muscle temperature. The rise in muscle temperature increases flexibility of elastin fibers, which in turn increases muscle flexibility and range of movement. Tissue elasticity is the capability of a muscle to stretch, to reach its full range of motion with no restriction. Okay, so it says full range of motion and it's talking about a muscle. But earlier we saw it in writing. Range of motion refers to the movement of a joint. So be prepared that there can be some little tricky areas, like the definition of range of motion can be a little bit flexible here and there. But we need to say again. It depends on how they word it, which is context, right? And it depends on what they're asking. Let's go back to the one with joint range of motion. No. Now I'm not finding it. Okay, all right. We're just gonna have to move on. Okay. Let's see. Which of the following is incorrect? Number 48. The length of each massage session is usually the same for each client. Which of the following is incorrect? The length of each massage session is usually the same for each client. A client should continue massage therapy sessions to aid in maintaining good health. Assessment of the client should be performed before, during, and after the massage therapy session, or none of the above. What do you think?
I'm gonna say A.
The length of each massage session is usually the same. Assessment of the client would be, go ahead. Yes, that should happen. So that statement is correct. Yeah. Yeah, and the question is which of the statements are incorrect. So let's see. The length of the massage session is usually the same for each client. Well, it depends on how you structure your business, actually. But according to the MBLEx, on the MBLEx, it's correct. The length, or it's incorrect, I should say. It's A is the correct answer, and the statement is incorrect. The length of each massage session is usually the same for each client. Depending on the needs of the client and the reasons for seeking massage therapy, the length of each massage session varies by person. Now, you will find settings in spas, for example, where they have what is called a menu of services. Dig that term. Who deals with items from the menu? Servers. We are not servers. Anyway, that's my other son, Max. And I'm just going to turn the camera off. But in a spa where there's a menu of services, people can choose, 30-minute, 60-minute, 90-minute, et cetera, massages, right? But in a private practice or in a practice where it's up to you, you can make all the massages the same length, or you can decide, I'm going to shorten or lengthen the massage based on the needs of the client. Okay, moving on. What is aimed at identifying the most suitable type of massage for a client? Whereas blank is necessary for assessing the effectiveness of treatment and planning subsequent sessions. So let's try fitting these in. Range of motion exercises is aimed at identifying the most suitable type of massage for a client, whereas pre-assessment is necessary for assessing the effectiveness of treatment and planning subsequent sessions. Consultation is aimed at identifying the most suitable type of massage for a client, whereas therapy is necessary for assessing the effectiveness of treatment. Is therapy necessary to assess the effectiveness of treatment? No, I don't think so. Pre-assessment is aimed at identifying the most suitable type of massage for a client, whereas post-assessment is necessary for assessing the effectiveness of treatment and planning subsequent sessions. That could work. Fitness assessment is aimed at identifying the most suitable type of massage for a client, whereas initial consultation is necessary for assessing the effectiveness of treatment and planning subsequent sessions. I think it's C, pre-assessment and post-assessment. Yeah, and that's it. You guys got to make sure you read every word. Sometimes read through it 4 times. These long, like, these ones where they give you like, like a very long sentence like this, unfortunately, you got to read through the whole thing. It helps to repeat it. And the fill in the blank too is tricky. I don't like it. Which of the following is true? Boundaries can be communicated by verbal conversations or body language. Boundaries may be determined before a session to ensure the client's comfort. Boundaries can refer to physical limits of space determined by individuals in which they feel safe and secure. In massage therapy, boundaries are the same for each client. Okay. Boundaries can be communicated by verbal conversations or body language. Is that true or not true?
True.
Boundaries can be communicated by verbal conversations or by body language. True or not true? No, they cannot be? Okay. Anyone disagree with that?
I disagree.
Yeah, okay. All right, let's keep moving though. All right. Number 2, the second option is boundaries may be determined before a session to ensure the client's comfort. True or false? Boundaries can be determined before a session to ensure the client's comfort. That's true.
True.
Boundaries can refer to physical limits of space determined by individuals in which they feel safe and secure. True or false?
True.
Boundaries are the same in massage therapy for each client. True or false?
True.
Yes, true. Yes, definitely true. Some clients need a cover, some don't. Some clients are going to be okay with you working close to their pelvis. Just as one example, some clients are not going to be. Some clients are all right having areas which harbor trauma or provoke feelings of fear. Some clients are okay having those touched, some clients are not. So let's try 2 and 3. 2 and 3. That's not an option. Boundaries may be determined before a session is number 2. Yeah, I think that's true. Boundaries can refer to physical limits of space defined by individuals where they feel safe and secure. Yeah, I think 3 is true. Boundaries can be communicated by verbal conversations or body language. Oh, yeah, number 1 is included. 1, 2, and 3. Correct. Okay, if a client fails to understand the boundaries in his or her professional relationship. Oh, I should stop for a second. No, we started like, I don't know what it was, 25 minutes late.
Mhm.
Is it okay? Is it okay if we go to 8:25? Larissa, Crystal?
I'm okay with it.
I have to go. This is Crystal.
Okay. Well, you can watch the video, Crystal.
Okay, that's fine. I can
All right.
keep it.
Okay. You'll get a Zoom link so you can download it, and you'll get a Facebook. You'll get a YouTube link so that you can watch it. I think you can also download it from
Yeah.
YouTube. Please do the download from Zoom within 24 hours because it'll delete after that.
Okay, sounds good. Thank you.
You're welcome, Crystal. Have a good night. Please let me know if you have any criticism, things that you want changed or you'd like changed or problems you want to bring up. Same for the rest of you. Okay, have a good night. And we continue on. If a client fails to understand the boundaries in his or her professional relationship with the massage therapist, this can lead to poor delivery of treatment to the client, massage therapist earning a bad reputation, loss of income for the business, legal troubles such as lawsuits filed against the therapist or the business. If the client fails to understand the boundaries in his or her professional relationship with the massage therapist, this can lead to lawsuits, loss of income, loss of reputation, poor delivery of treatment. I think it's 1, 2, and 3. What do you guys think? One, 2, and 3. So you don't think it's legal trouble such as lawsuits against the therapist or the business? I think it's all of the above. Yeah, so 1, 2, 3, and 4. That's right. Which of the statements below is incorrect? Establishing close relationships with clients may greatly affect a person's professionalism. Is that true or false?
Mm,
Establishing close relationships with clients may greatly affect a person's professionalism. That's your professionalism.
it's true.
Is that correct or incorrect? Yeah, that's correct statement, true statement. If a client begins asking personal questions during a conversation with a therapist should not refuse to answer. That is to say, the therapist should answer. Is that correct or incorrect?
That is correct.
If a client begins asking personal questions during a conversation with a the therapist should not refuse to answer. Correct or incorrect? Correct. Incorrect, yeah.
Incorrect. Yeah, I miss.
Yep. Yeah, you got to watch for the negatives, right? Because there's a
Yeah.
single negative word there, not refuse. Not. Okay, appropriate behaviors in the massage room reinforce professional boundaries. Correct or incorrect?
Proper behaviors.
Appropriate behaviors in the massage room reinforce professional boundaries. Correct or incorrect? Yep.
Correct.
A therapist should maintain similar rules and codes of conduct with all clients during all sessions. Correct or incorrect?
Correct.
Yeah. So we got it right. It's refusing, should not refuse to answer is incorrect. Okay, select the incorrect statement. If a client appears to be responding negatively during a massage session, the therapist should pause and ensures that the reaction is not a result of any of his or her bad behavior or comments. His or her behavior or comments. It's not incorrect. Yeah, I would say that that's correct. Ethical dilemmas present themselves in a very clear manner. Ethical dilemmas present themselves in a very clear manner. Is that correct or incorrect?
I don't think I'm understanding that one correctly.
Okay, ethical dilemmas, ethics. One definition of ethical or ethics is two choices which are both correct, and you have to find the better of two choices. It's choosing the better of two choices, two correct choices, choosing the better of two correct choices. So sometimes they don't present in a manner that's clear. So an ethical dilemma presents themselves in a very clear manner. Is that correct or incorrect?
Correct.
Okay, ethics means making a choice between two choices which are both correct. They're both correct. Now, if you have two choices that are both correct, is there a clear, correct ethical answer, or is it less clear?
Oh, no.
It's less clear. Now, listen to the question and the answer. Select the incorrect statement. Ethical dilemmas present themselves in a very clear manner. Is that statement incorrect or correct?
Incorrect.
Yes. And let's read the last one. Professional boundaries encompass everything that determines your safety zone. They may be influenced by past experiences, beliefs, and values. Is that correct or incorrect?
Correct.
Personal boundaries encompass everything that determines your safety zone. They may be influenced by past experiences, beliefs, and values. Correct or incorrect?
Correct.
It is correct, yes. Oh, look at that. I got it wrong. Ethical dilemmas present themselves in a very clear manner. Okay, this is important. This is important. This is important. Because this is not intuitive. This is counterintuitive. An ethical dilemma totally seems like it may be very unclear to me. So this is that they're saying this is correct. This is not intuitive. All right, so let's select the other ones. Ooh, okay. The incorrect statement is, according to MBLEx, if a client appears to be responding negatively during a massage session, the therapist should pause and ensure that their reaction is not a result of any of his or her behaviors or comments. That is incorrect, according to MBLEx. Remember, correct in clinic does not mean correct in MBLEx. We got to find out what's correct for MBLEx, in MBLEx world.
That is so
Sometimes
confusing.
yes, it is. Yes, it is. Let's read the explanation. Maybe it'll help us. Sometimes boundary issues are subtle and begin little by little. Boundary issue, they're calling an issue a problem. Sometimes boundary issues are subtle and begin little by little. A therapist may not even realize that he or she is being unethical. Fortunately, these issues can be recognized and minimized or avoided by regularly checking and following the rules and guidelines of your business. Following these rules and codes of conduct is important to the professionalism of the field of massage therapy. The main types of boundaries relating to massage therapy practice include legal, professional, and personal boundaries. Okay, Larissa, be honest, does that clear it up?
Mm. Can you read it one more time?
Yes.
Okay.
Actually, Larissa, why don't you read it? Can you see it here?
Yeah.
Okay.
Sometimes
Okay,
boundaries.
so
Oh, okay.
go ahead.
Okay, so the question is, let me see the question again. Oh, okay, incorrect statement. If the client appears
Yes.
to be responding negatively during a massage session, the therapist should pause and ensure that the reaction is not a result of his behavior or comment. Okay, sometimes boundary issues are subtle and begin little by little. The therapist may not even realize that she is being ethical. Fortunately, these issues can be recognized and minimized or avoided by regularly checking and following the rules and guidelines of your business. Following these rules and codes of conduct is important to professionalism of the field of massage therapy. The main types of boundaries related to massage therapy practice include legal professionalism and professional boundaries. Okay, so
Okay. Okay, so the explanation, Larissa, look, do you say Larissa or Larissa or Larissa?
whichever one, it doesn't matter to me.
Okay, okay. So the explanation, Larissa, refers to the two correct statements. So ethical dilemmas present themselves in a very clear manner. Sometimes boundary issues are subtle and begin little by little. No, that's not supporting what I'm saying. I'm sorry. Ethical dilemmas present themselves in a very clear manner. Issues can be recognized by regularly checking and following the rules and guidelines for the business. It's important to the professionalism of the field. I guess I could say that that's clear. Personal boundaries encompass everything that determines your safety zone. They may be influenced by past experiences, beliefs, and values. The explanation doesn't really refer to that one either. Okay, I think this is like really poorly worded, don't you guys? Yeah, so let's keep in mind and try to remember that MBLEx doesn't want you, try to put it in context.
Pass.
MBLEx doesn't want you to have a conversation with a client if the client appears to be responding negatively during massage therapist, to assure that the result is. You agree on that? I wouldn't. I mean, I see that MBLEx wants that, but I don't agree with that in practice. But that again, we're separating clinical from MBLEx, right? We're separating the test out from clinical. All right, let's move on. Thanks for your patience. In massage therapy, a dual relationship is a personal connection that a massage therapist has with a client that extends outside of his or her professional duties. A budding romantic relationship, I've read enough. A relationship in which a massage therapist provides services to certain clients free of charge. An unprofessional relationship between a client and a massage therapist. It doesn't have to be unprofessional. Yeah. Yeah. A dual relationship can occur due to a previously established relationship or may develop over time as a cause of meeting through massage therapy services. These relations include relations that are romantic, friendly, business-related, and family-related in nature. Examples of dual relationships would include providing services to acquaintances, family members, or romantic partners. Because the client no longer views the therapist in strictly the context of a health profession, there can be negative effects that arise from a dual relationship. Therapeutic relationships are possible with known clients, however, maintaining appropriate professional boundaries allows therapists to ethically provide services. In massage therapy, what occurs when a client transfers certain feelings, thoughts, and behaviors onto a therapist and tries to make the professional relationship personal? What occurs? Countertransference, dependency, transference, or scope of practice? Which one occurs when the client transfers certain feelings, thoughts, and behaviors onto a therapist and tries to make the professional relationship personal? Which one? I think it's either transference or countertransference. C, transference. Let's try that. That is correct. What can be blank can be recognized by certain behaviors the therapist expresses, such as using their client as a confidant, counselor, a mother, or father figure. What can be recognized by certain behaviors the therapist expresses, such as using their client as a confidant, a counselor, a mother, or father figure? Dependence, countertransference, sexual misconduct, or transference? Which one? That is not correct. Is it dependence, countertransference, or sexual misconduct?
Counter?
That's correct. Countertransference is the displacement or transfer of feelings, thoughts, or behaviors related to a significant person or event onto a client by a therapist. That's the reverse of transference. From client to therapist is countertransference. From therapist to client is transference. Okay, Amos. Yes. You want to hear the question again? Okay. Blank can be recognized by certain behaviors the therapist expresses, such as using their client as a confidant, a counselor, a mother, or a father figure. Sorry, I just had to shut my window. Does that make sense? Okay, great. Okay, a massage therapist can detect countertransference. Which way does countertransference go?
Client to therapist?
Client to therapist, yes. From client to therapist. A massage therapist can detect countertransference in his or her relationship with a client if he or she, the therapist, does which of the following? Oh, wait. It would be he or she, the client. Yeah. I'm going to assume it's he or she, the client. Do you know how I can tell from the sentence? The way it's worded, it's the client is closer to he or she. Do you guys see that? If he or she does which of the following? Has unusually strong feelings, positive or negative, toward the client. That's a reference to the therapist. This is a misplaced modifier. He or she here is a misplaced modifier. We got to go with it. We got to roll with it. Bends professional and personal boundaries to accommodate the client, shares personal problems and future plans with the client, thinks excessively about the client after the treatment is over, referring to the therapist. Massage therapist can detect countertransference in his or her relationship with a client if he or she does which of the following? Which ones? Has unusually strong feelings, number one. Number two, bends professional and personal boundaries to accommodate the client. Number three, shares personal problems and future plans with the client. Number four, thinks excessively about the client after the treatment is over. Let's try all four. And it is all four. Yes. Okay, let's review this because I just reversed the definitions. I said countertransference is from client to therapist. It's not. Countertransference occurs when the therapist is unable to separate the therapeutic relationship from the personal feelings surrounding the client. Let's go back. Countertransference is the displacement of the transfer of feelings, thoughts, or behaviors related to a significant person or event onto a client by a therapist. From therapist to client, countertransference goes from therapist to client. Transference is the displacement or transfer of feelings, thoughts, and behaviors originally related to a significant person, such as a parent, onto someone else, such as a massage therapist. Transference goes from client to therapist. Transference goes from client to therapist. Countertransference goes from therapist to client, from therapist to client. Yes, the last one here. A massage therapist can detect countertransference in his or her relationship with a client if he or she, the therapist, does which of the following? Has unusually strong feelings, positive or negative, toward the client, bends professional and personal boundaries to accommodate the client, shares personal problems and future plans with the client, thinks excessively about the client after the treatment is over. It's all of the above. So first of all, it's 1, 2, 3, and 4. Okay. So 1, if the therapist has unusually strong feelings towards the client, that is countertransference, therapist to client. Number 2, if the therapist bends professional and personal boundaries to accommodate the client, that's countertransference from therapist to client. Number 3, shares personal problems. If the therapist shares personal problems and future plans with the client, that's countertransference from therapist to client. And number 4, if the therapist thinks excessively about the client after their treatment is over, that's countertransference from therapist to client. Is that clear? Good. It pays to be thorough. That's what these classes are for too. All right. Signs of transference displayed by clients include inviting the practitioner to go on dates. Remember, transference is from client to therapist, from client to therapist. Inviting the practitioner to go on dates, frequently asking the practitioner about his or her personal life, bringing the therapist gifts, refusing to continue with a massage midway through the session, asking the therapist about risks involved in treatment and session. It's not asking about risks involved because that's informed consent. Refusing to continue with massage midway through the session, that's not necessarily transference. Sounds like some boundaries have been crossed. Bringing the therapist gifts, yeah, from client to therapist, definitely a mix up there. So let's try 1, 2, and 3. Is that an option? All right, great. Is that unclear to anybody? Okay, so transference is the placement of feelings or identifying with a person inappropriately. It's who's doing the identifying, client or the therapist?
Client.
Yes. Larissa, do you understand?
Yes.
Okay, so it's when the client identifies with the therapist inappropriately. Now, asking a therapist, let's go in reverse order. Asking a therapist about risks involved in a treatment session. Is that inappropriate relationship or inappropriate identification from the client to the therapist?
Yes.
Okay.
Asking the therapist.
Risks, yeah. Risks involved in a treatment session. That's actually part of the what?
Of the session.
It's part of the informed consent. Process of informed consent. Right, and then, excuse me just a second. You have to eat at the table. I understand that. We do not eat on our desks. You have to eat here. Your devices don't go at the table. Thank you. Okay. Refusing to continue with a massage midway through the session. That's just drawing a boundary, right? Yeah, that's not really feelings or identifying with the therapist inappropriately. You know, that's not seeing the therapist as a romantic partner or as a friend or as a, you know, personal relationship, right? Right. Okay. Bringing the therapist gifts. Now, is that a relationship with the therapist that is of a personal nature, maybe even a romantic nature? Yeah, it could be both, but that's outside of the professional relationship, right? So that's transference, bringing the therapist gifts from client to therapist. From client to therapist is transference. From therapist to client is countertransference. Yes, yes, you just need to hear it enough, like several times, I think. Repetition is the mother of learning. Okay, frequently asking the practitioner about his or her personal life. The client asking the therapist about his or her personal life. Transference or not? Yeah, because it's what kind of feelings, what kind of identifying that the client is doing to the therapist, what kind? Yeah, reaching over the what boundary? Yes, but professionalism is included in ethics, so go down the ladder further. It's reaching across crossing the professional boundary, right? So it's not professional. We could also say that it's personal in nature. And then inviting the practitioner to go on dates. Gee, ooh. Ooh. Where's my calculator? Let me just do the math on this one. What do you think? Transference or not?
Absolutely.
Definitely. Definitely. Okay. Now, are we clear on why refusing to continue the massage midway through the session is not transference?
Mhm.
Okay. Are we clear on why refusing to continue with the massage midway through the session is not transference? It's drawing a boundary?
Yes.
Good. And are we clear why asking the therapist about the risks involved in the treatment is not transference, but it's informed consent? Okay, great. Okay, guys, great work. Thanks for sticking with me tonight. I'm sorry about the rough start. Ginny, please troubleshoot everything as we discussed so that we can all go to the same Zoom link and be ready to go at 6 o'clock Eastern time on Wednesday.
Yeah.
Okay. Okay, great. What's that? Okay, I'm glad it was good. The goal is to be helpful. All right. Thank you very much for your patience, guys, and I will see you Wednesday at 6. Please text me if you have any questions or any feedback. Okay. All right. Bye-bye.